Cancer continues to be a significant health burden affecting countless individuals and families across the country. Uganda Cancer Institute alone sees over 6,000 patients annually with a survival rate of 20%. It is against this backdrop the Ministry of Health, Uganda Cancer Institute and Palliative Care team organized the 4th Uganda Conference on Cancer and Palliative Care to forge a way on new innovations that can transform cancer and palliative care in the country.
Cancer imposes significant economic cost, estimated at up to $1.16 trillion annually. With projections of exponential growth, unless we take decisive action to cap the rising number of cases and their impact on individuals and national budgets. The government is committed to providing financial support to reduce the burden of cancer.
Dr. Jackson Orem, the Executive Director of Uganda Cancer Institute, notes that government has put in place proactive steps and measures to help improve on the outcome and the survival rate of cancer patients in the country.
Right now in Uganda, for every 100,000 population, the number of new cases of cancer has now risen to up to about 250,000. So that means if you put together 100,000 people, among those 100,000 people in Uganda, 250 of them will be having new cancers. So
health experts are calling upon the government to heavily invest in early diagnosis programs for common cancers and also mainstream palliative care programs across healthcare in the country.
In the area of research, we have little research in regards to palliative care. But the milestone I can celebrate with you today is we have the palliative care data integrated in the National Health Information Management System. So this will enable us to collect data for palliative care and it will inform the need in our country.
Palliative care is integrated in the National Cancer Control Plan, which is in the pipeline, and still that is in an effort to ensure that we implement the law on cancer that integrates palliative care. Also, I want to acknowledge the fact that palliative care is not just for cancer, and I've seen at the UCI we have a strategy to mainstream HIV/AIDS within cancer care training and research, and this is still important for the integrated approach that we want to take to ensure that patients have access to quality, comprehensive and affordable services.
Zahra Abigaba, UBC News.